Ultrasonography is a commonly used tool to evaluate the status of pregnancy. Complications arising from pregnancy are frequently encountered complaints in emergency departments and prenatal clinics. Though home pregnancy tests are increasingly popular, some women may discover they are pregnant for the first time in the outpatient setting. A true gestational sac can be distinguished from a pseudo-gestational sac by noting these points. 1. Its normal eccentric location. It is embedded in the endometrium rather than centrally within the uterine cavity. 2. Presence of the double decidual sign, most helpful at 4 to 6 weeks. 3. Presence of a yolk sac. Seen at approximately 6 weeks, unequivocal evidence of a gestational sac. However, caution should be exercised with a diagnosis of a pseudo-gestational sac. In a woman with a positive beta-HCG, any intrauterine sac-like fluid collection seen on ultrasound is highly likely to be a gestational sac. An irregular gestational sac, lack of a smooth contour and/or presence of a distorted sac shape is highly suggestive of an abnormal intrauterine pregnancy. First trimester ultrasounds are not a requirement for all pregnancies to confirm viability. However, if any high-risk features, such as advanced maternal age, twin pregnancy, and/or clinical concerns are present, such as irregular menses, vaginal bleeding, more than one ultrasound may be performed at the clinician's discretion. With the first ideally in the late first trimester between 10 and 13 weeks. However, ultrasound exams before 10 weeks are common and can still be used as accurate assessments for most necessary clinical determinations. It may be utilized as a part of the standard evaluation during pregnancy or to elucidate other concerning signs and symptoms. Missed abortion as a pregnancy complication. Missed abortion is when a pregnancy stops developing, where the embryo-fetus embryonic tissue or empty gestation sac remains in the uterus and the cervical os is closed. Symptoms may include pain, bleeding or no symptoms at all. If an ultrasound is done, the scan may show an embryo or fetus without cardiac activity or what appears to be an early developing pregnancy with only a fluid-filled sac visible within the uterus. Medical, surgical, vacuum aspiration, and expectant management are all options for management of missed abortion. The causes of missed abortion are not fully known. About 50% of miscarriages happen because the embryo has the wrong number of chromosomes. Sometimes, miscarriage may be caused by a uterine problem like scarring. You may be at higher risk for missed miscarriage if you have an endocrine or an autoimmune disorder or are a heavy smoker. Physical trauma can cause a missed miscarriage as well. Ultrasound diagnosis of miscarriage should only be considered when either a mean gestation sac diameter is greater than or equals to 25 mm, with no obvious yolk sac, or a fetal pole with a crown rump length of greater than or equals to 7 mm, without evidence of fetal cardiac activity. Transvaginal ultrasound is the mainstay in the diagnosis of miscarriage. Once the diagnosis of miscarriage is made based on the above ultrasound criteria, the patient can then be offered different types of management depending on their clinical status and patient's choice. Expectant management is possible, with a wait-and-watch approach offered after careful counseling to women who have met the inclusion criteria. Was quite easy, right? Learning is fun. Subscribe for